Today, we're going to go above the pelvic floor. So we are looking up above the pelvic floor. This is going to encompass our chest, our ribs, our shoulders, our neck, everything above that pelvic girdle. And why do we care? Well, I think it's really helpful to just understand how this whole system works together, and also just to keep an eye out for some of those symptoms that aren't necessarily pelvic floor obvious, right? So thinking things like leaking and pain with intercourse and urgency, frequency, these can all be very obvious pelvic floor dysfunction symptoms, right? But whereas plantar fasciitis, TMJ, migraines, neck pain, these aren't necessarily as obviously related to our pelvic floor. So that's why I wanted to do this series, so that you guys could just really understand that bigger kinetic chain. And so if you do have symptoms like migraines or chest pain, upper back pain, even shoulder pain, might be related to pelvic floor, especially if you do have some of those more obvious symptoms like leaking or tailbone pain, pain with intercourse, heaviness, low back pain, hip pain, right? All the pains and things that I talk about in every episode. Hey, I'm your host, Dr. Desiree Cassell. I'm an orthopedic and pelvic floor physical therapist specializing in women's health, aka pelvic floor. I'm a wife, mom of 3, foodie, lover of all things movement and nature, and I'm super passionate about educating, empowering, and supporting other women like you to find and maintain balance throughout all aspects of their lives, without pain, pressure, or peeing their pants. And this is the Balanced Momtality Podcast, where we will talk about all things pelvic floor, your core, and optimizing your pregnancy, birth, and postpartum recovery, providing you with the knowledge and tools so that you can feel like the strong, playful, and happy mom that you and your family deserve. Now let's get you out of those pads and back to loving movement. Fill up your water, pop in those AirPods, roll out your mat, and let's connect. Before we start today's episode, just a quick disclaimer that anything mentioned in this podcast is not meant to treat or diagnose any medical conditions. If you have any questions or concerns about your healthcare needs, please seek the care of your medical provider. This is also a safe space where we will be talking about very sensitive but important topics, such as issues with peeing and pooping, relationships, and even sex. So if you have littles around, probably a good idea to pop those AirPods in. But otherwise, I hope you enjoyed today's episode. All right, my loves, we are back, and I just have to say I am so sorry if you've been paying attention for the first time since doing this podcast. So it's been, almost 70 weeks. I missed a week, and it hurt my heart. I tried so hard. I went on vacation. I even batched content, so I had a podcast come out while I was on vacation. But, when you come back from vacation and you're scrambling to get back into real life, and then the week goes by and you realize, shoot, I didn't do a podcast. So that's just the reality of things. I had an amazing podcast come out last week, though. I had a great interview with registered dietitian Jessica Brown. If you missed it, please go check it out, because it is such a good show. I have told so many of my friends and family about having this interview, because there's just such good takeaways inside that episode. Obviously, Jess gives us some great practical tips, but I think the best part about our chat was we really dived into the inner workings of our mind and our relationships around food, and some of those red flags that you can start to look at to see and really look at your own relationship with food, and if there might be some work there to do. The other big take home that I just think was such a good one was that we don't eat enough, especially as women. We just tend to restrict, and that can cause way more issues, especially for our hormones and our gut microbiome than we think. So go give that episode a listen. It was just last week, my interview with registered dietitian Jessica Brown. So good. But this week, I am diving back into some pelvic floor topics. I did an episode a couple weeks ago about looking below the pelvic floor, and we talked more about foot health and how our foot health really impacts our pelvic floor. So another really good episode to listen to if you haven't already. But today we're going to go above the pelvic floor. So we are looking up above the pelvic floor. This is going to encompass our chest, our ribs, our shoulders, our neck, everything above that pelvic girdle. And why do we care? Well, I think it's really helpful to just understand how this whole system works together, and also just to keep an eye out for some of those symptoms that aren't necessarily pelvic floor obvious, right? So thinking things like leaking and pain with intercourse and urgency, frequency, these can all be very obvious pelvic floor dysfunction symptoms, right? But whereas plantar fasciitis, TMJ, migraines, neck pain, these aren't necessarily as obviously related to our pelvic floor. So that's why I wanted to do this series, so that you guys could just really understand that bigger kinetic chain. And so if you do have symptoms like migraines or chest pain, upper back pain, even shoulder pain, might be related to pelvic floor, especially if you do have some of those more obvious symptoms like leaking or tailbone pain, pain with intercourse, heaviness, low back pain, hip pain, right? All the pains and things that I talk about in every episode. But looking above, so the first thing I want to have you bring your awareness to is chest pain. So if you're having any chest pain, or this encompasses the ribs, so we'll talk rib and chest, so that whole thoracic spine, right? Back pain in the upper back in between your shoulder blades, neck pain, chest pain, looking at that chest and that thoracic girdle is crucial to healing your pelvic floor, but also to improving that whole core system, and vice versa. Both of these all of these work both ways, right? So having dysfunction in your pelvic floor can cause issues up above like TMJ and neck pain and all of that, but vice versa, we can have TMJ and neck pain causing pelvic floor dysfunction, pain with intercourse, pain with sitting, leaking, all that stuff. So why? Why does it do that, and how? And so the obvious thing is it's all connected, right? Like our bones are all connected. It's all one chain. But beyond that, our fascia is all encompassing. Our fascial system is something that, if you're not really familiar with fascia, the way I like to think about it is it's kind of like that white layer over your chicken breast. It's that layer you kind of pull off. It's that white thin layer. And our bodies, our muscles also have that white coating, that fascial sheath over all of our muscles, our organs, our joints. And the cool part is it's all one connected piece. There are multiple different systems and components, if you will, of the fascia that can kind of change the direction of the fascial line and that kind of thing, and the direct line of pull, but the reality is it's all connected. So the way I like to think about it is, if you were to be wearing a shirt and you were to, maybe tie it in a knot, that's kind of like a trending thing, crop tops tying our shirts in knots. So if you were to tie that shirt in a knot, you would see not only the tightness right at the knot, so we can think of this as something like a scar. So if that knot is a scar, it could be an abdominal scar from a C-section or a laparoscopy, or an open big scar. It could be a tiny scar. It could be a scar on your back, anywhere. A scar is really like a tethered space, right? That scar tissue usually adheres to every layer, not just that superficial skin. So it's adhering everything, skin, fat, fascia, muscle, everything is kind of adhering in that scar space. So if you have that knot in that shirt, you're not only seeing the knot or the scar, but you can also see the pulls in the shirt, those tightened lines in the shirt, and they spread everywhere, right? Those lines kind of go towards the back, they come up towards the breast a little bit, and that kind of shows you how there's a fascial tug in your system. If you have a scar or any tension or tightness where there's fascial restriction, it's not only impacting that one spot, but it's pulling from other places in the system as well. So the fascia is one big reason why this all is connected and really can cause impact with each other, especially things like TMJ. So if you have TMJ or you're a jaw clencher and you have jaw pain, which is TMJ pain, then this is a direct link to the pelvic floor through our fascia. There is a direct line of pull from our jaw and our pelvic floor. So if you are clenching your jaw, that pelvic floor fascia, and in turn the muscles in the pelvic floor, are also going to get lifted and a little bit restricted and tight. And so that in itself can cause a lot of issues like constipation and pain with intercourse, tailbone pain, pubic bone pain. There's lots of direct issues with TMJ specifically. But even if we're just looking at like the chest and the ribs, and maybe you don't even have any scarring, but you just breathe shallow. This is a huge one, guys, a huge one. And I know you know why. And if you don't, it's the breathing. Our breathing is the magic sauce for all things healing in our body and for restoring our core system. But especially if we're having obvious pain, like neck pain, chest pain, pain in our upper shoulder blades, in our traps, if you're like, oh, I just carry so much tension in my shoulders and in my traps, and I've always got these trigger points and I've got these headaches, your breathing might be one of those big causes. If we breathe shallow, a lot of things happen, and not good things. I mean, yes, it serves its purpose. If we are breathing shallow, we're usually in a state of stress. And if we're in a state of stress, yes, maybe we don't need all the blood flow going to certain parts of our body, but in reality, it increases cortisol, it increases tension, it increases stress and mental stress, and it becomes a vicious cycle. And the physical piece of this can be really detrimental because if we're breathing shallow, you're also using a lot of the accessory muscles that we use to breathe, that we shouldn't really be using to breathe. That's why they're called accessory, because if we're really just taking that huge, big breath, and you see those shoulders rise when you take that big breath, that's using those accessory muscles. So they're there to help if we really need them to. But the reality is, if we're using them consistently every time we're taking a breath, we're actually really harming our body, really. The tension in our system and in our neck specifically is going to drastically increase. Those muscles are overworking. This can even cause nerve issues down the hand, carpal tunnel, tennis elbow. All of these issues can come from stiffness in that base of the neck, and that can really be caused directly from breathing shallow. So that first step is just check in with your breathing. Are you just breathing into your chest? Are you seeing your shoulders rise? Because you shouldn't. When you're taking a nice deep breath, remember, we want to fill up from the bottom up. We're really trying to get that pitcher full from the bottom up. But that doesn't mean we just fill up our pelvic bowl and our belly and our back, because if we only do that and we don't ever bring the breath up into our chest, then we're also in trouble because our chest and our ribs are meant to expand. They're there to protect our organs, but they're also there to provide a lot of stability in our body, and they move with our breath. They're supposed to move with your breath. Those ribs are shaped like a C, and they create like a bucket handle movement when we breathe. So when we inhale and breathe in, that bucket handle expands and that lifts up the ribs. When we're exhaling and breathing out, those ribs fall back down and that bucket handle drops. If there's no movement in the ribs, you begin to get a ton of stiffness. And the ribs and the rib cage, the thoracic spine, because of the ribs, is already a very stable space in our body, right? There's lots of ribs and bony structure there keeping that stable structure. So in that space of our body, we actually really need mobility. We need to make sure things are also moving, or else we get chronic neck stiffness, chronic back stiffness, chronic chest tightness, shoulder issues, because that can also perpetuate postural problems. If you are tight and stiff, and if you're breathing shallow, I'm going to also guess your shoulders are a little elevated and they're a little pulled forward, which is going to pull you into that slouched posture. And it doesn't have to be an obvious super slouched posture, guys. Even just a slight forward head and rounded shoulders is going to create tightness in the chest. And it's kind of a chicken or the egg. Did our slouching posture create tension in our chest and stiffness in our thoracic spine? Or did our breathing and how we're using our body create tightness and therefore pulling us forward? And it really doesn't matter, because you want to work on all of these pieces. We're going to address the breathing, really get that chest to expand in those rib cage, the ribs in the rib cage to move, especially laterally. So you want to be able to, if you place your hands around your rib cage, the side of your ribs, so it's like you're just putting your hands around your rib cage. When you breathe in, you should feel that lateral movement, the breath come into the sides. Yes, we want to see front and back expansion as well, and see front of belly expand and those kinds of things. But if you're not getting those ribs to expand to the side, you're also not getting full diaphragmatic movement. That diaphragm should be able to fully open and expand and contract when you're inhaling. And if you're not getting that rib expansion, you're not getting the full benefits of the diaphragm, and you're also getting a lot of stiffness and restriction within the rib cage. And this can cause a lot of costochondritis, which is just another fancy term for joint pain in the ribs, right? So the ribs might be really inflamed and sore and tender. I've had a couple patients be really fearful of this because they thought they were having heart issues, when in fact it was just some rib pain. And so we want to make sure that that breathing is normalized and we're getting it fully, not only through the bottom of our core, but also up into our thoracic spine and into our ribs. So just start checking in with the breathing and seeing how you're breathing, checking in with the depth and making sure that those ribs are getting some mobility. But again, our posture is another huge piece of this, because with that posture, we tend to see a lot of that up above. When we think bad posture, it's usually because we're slouching and we see that curved spine, our shoulders are falling forward, our head is falling forward, and that in itself is a lot of pressure on the pelvic floor. So even if you're breathing normally, but you're just slouching a lot throughout the day, that is going to create the obvious things like neck pain, back tightness and back pain, and maybe some shoulder pain. But it's also going to cause some pelvic floor symptoms because you're compressing the organs and everything internally down onto the pelvic floor. And then that pelvic floor has to fight that pressure. And so again, remembering that healing our core system is not just about strengthening our pelvic floor or our core and doing all these exercises, but it's also about learning how to manage your pressure appropriately. And posture and breathing are crucial for that management of pressure. So just start bringing some awareness into that postural piece. Think about that line through that high ponytail line, right? And I actually just had a patient mention a cue today to me that she says has always helped her. And I thought it was a really good one. So I'm going to just tell you guys here. She always thinks about her spine as a string and her head is the balloon. So she's trying to stack that balloon over the string, right? Which I think is so great. Just a great visual to think about stacking your head on top of that spine. And not forgetting, right, that when we stand tall, that doesn't mean our ribs flare out. So if your chest sticks out when you stand tall, you're actually compressing your low back, you're pulling on the abdominals, and we're not in a nice neutral stack. So that's not where you want to be. When I think about posture and when I teach posture, I like to think about it, especially if we're thinking about it from sitting, right? Because I think this is a very common one when we're sitting at the computer and working and we're slouching and then we're like, oh, wait, I got to sit up straight. So from there, I like to think about it from the bottom up in the pelvis. So is my pelvis in neutral? Because your pelvis is a cylinder and so is your rib cage. And when we're in a nice neutral position, which is where we want to be most of the time, especially if we're at rest, or in a position for a long period of time. Neutral is the space that your joints and your muscles and your tendons and ligaments are going to get the least stressed and irritated. So neutral is a space where your pelvis, you feel equal weight through your sit bones. So first things first, are your sit bones even touching your seat or the floor or wherever you are? Because you should feel equal weight in those sit bones. But then are you in neutral? So to find that out, you want to move through both extreme ranges of motion. So find where you think your neutral is, and then from there, check in. Can you tuck your tail like a dog? Can you fully tuck and go into a posterior pelvic tilt? If so, great. You weren't in that posterior pelvic tilt. So then you go back to where you feel neutral is, and then you see, can I stick out my tailbone? And does it feel like there's about an equal amount of motion there when I arch my back and stick my tailbone out? Because if so, then you are in neutral, that middle ground. You should be able to both tuck and extend that tailbone. And finding that space where you have equal weight through your sit bones can be super helpful. So once that pelvis feels like it's in a nice neutral stack, you're going to pull that balloon or that high ponytail line, that string through the high ponytail line tall, but not so much that your rib cage is flaring, okay? So we do want to stack that cylinder of the rib cage directly on top of the cylinder of the pelvis, so your ribs are not flared. Another nice visual for the rib cage with our posture is a bell. So if your bell rings up or your ribs are flared out, that is not neutral, but it also should not be flared or rung down where you're slouched and those ribs are more flexed down, okay? So we want to feel the outlet of the ribs and the inlet of the pelvis stacking directly on top of each other. But then as we come up into the shoulders, we want to think about our shoulders not just slouching forward and elevated, right? So we want to pull those shoulders down and back. I like to think about pulling one shoulder blade into the opposite butt pocket, and then you're doing that for both shoulder blades. But most people just do that and they forget about the head. And most of the time, your head and neck are also kind of slouched and fallen forward, right? We call that forward head. And we want to really get that stacked and in line as well. Because if you didn't know, every little bit of degree of motion that your head is flexed forward or hanging forward is exponential weight that you have to carry, and that those little muscles in your neck have to carry. So unfortunately, people with a lot of neck and head pain, they don't have a lot of neck strength, so they're slouched and they're hanging their neck, and it's actually putting a lot more weight on their muscles, and they don't have that strength. So then it tightens and it becomes more painful, and it's this vicious cycle. So just starting to get that neck and that head stacked on top of your neck and the rest of your spine can take a ton of weight off and a lot of strain and stress off of the muscles that have to hold you there. So thinking about tucking your chin straight back. So the chin tuck is something that I teach a lot of women, and we like to couple it with the shoulder squeeze. So that shoulder squeeze where you're squeezing those shoulders down and back should also be coupled with a chin tuck, which is where you're squeezing that chin directly back. You're trying to give yourself a double chin. This is not a chin tuck where you're tucking your chin to your chest and you're flexing your head down. Your vision field should not change. So when you tuck straight back, your eyes should still stay level. If you tuck too much, your vision field will go down, or if you extend too far back, it will go up. So you just want to keep that vision field nice and neutral. Tuck it back, give yourself that beautiful double chin, squeeze those shoulders back, and hold this for 3 to 10 seconds, anywhere that feels good. You're not squeezing so hard that you cause any spasms or tightness, but we also just want to engage those muscles and help our brain and our nervous system start to learn this new position. And yes, you're not living in this extreme chin-tucked double chin world, but relax just slightly out of that, and that's kind of where you want to hang out, especially when you're at a computer for a lot of work, sitting there for hours on end. Having that poor flexed forward posture just causes so much issues. So start screening your posture, start screening your breath, And we will start to see a lot of changes, not only in your thoracic pain, rib pain, neck pain, migraines, and all of that, but also in how your pelvic floor is functioning, because now the pressure is managed differently and the muscles can show up differently. But another piece that tends to get forgotten about when it comes to that upper quarter of the body, I mentioned before that our ribs are very stable, right? They're a very stable structure, so we need mobility. The breath is a great way to bring movement and mobility into our thoracic spine and our ribs. But another piece of movement that our ribs really love and they don't get enough of is rotation. So having that rotation in our thoracic spine is critical. This is how we walk. This is how we run. If you are so stiff and you don't get any thoracic rotation, this is why you see that reciprocal arm swing. You see the arms kind of swinging back and forth when you're walking and running. And if you don't, it's because your thoracic spine and your ribs are stiff as a board. And if that force isn't being transferred through your thoracic spine with that rotation, then it's going somewhere else. This could be the pelvic floor, it could be your neck, it could be your shoulders, right? So we just want to start improving that rotation and start making sure that it's actually showing up for you when you're walking and running and exercising and moving. So getting rotation in our thoracic spine is super helpful, but in a safe way, okay? So this doesn't mean you're going to go do a bunch of resisted rotational exercises, especially if you're a little older. That can be pretty hard on your body and can actually cause some issues, and rotation can be something we want to be careful of. So this is not how we're getting rotation in. What we are doing though is movements like thread the needle, bow and arrow. These are some of my favorites. And even just sitting in your chair and turning to look over your shoulder and using that arm to grab onto your chair and kind of help pull you into that rotation. And then you twist the other direction and look over the opposite shoulder and try and get more rotation on that side. That is like a seated bow and arrow. And so if you're not sure what bow and arrow are or thread the needle, I bet if you Google it, you will find something, but I'll try and do my best verbal description here. So bow and arrow, you are lying on the floor or a mat or your bed. It really doesn't matter. You're on your side, okay? So you're lying on your side. Your head is supported with a pillow because we want to promote a neutral spine here. And you have your arms both straight out in front of you and your knees are bent. So from above, this looks like you laying on your side with your knees flexed up and your arms are straight out in front of you. And then it's called bow and arrow because with that top hand, you're going to pull like you're pulling a bow back, and you're going to watch it and follow it with your head as you slowly turn and open up that thoracic spine. Your chest should start to turn towards the ceiling and your shoulders should start to fall towards the ground. Then you're just going to take a few breaths there and you're going to slowly roll back in and roll back out. This should be rhythmic and controlled and comfortable, similar to cat-cow. You're just slowly going in and out, pausing wherever you feel tension, breathing into that space of tension and continuing through that flow. Don't forget to flop over and do both sides. And in fact, if you do both sides and you find that one side is a lot stiffer than the other and you just cannot open up nearly as much, I would try doing only that side for a couple days to see if you can improve and create more symmetry and alignment within your spine. Because that tension and that stiffness and obvious discrepancy when it comes to rotation is a pretty good indicator that there's usually some stiffness or alignment issues in the spine. So that bow and arrow can help just encourage a nice neutral alignment and mobility throughout the back. Thread the needle is where you're on your hands and knees and you're going to take one arm and just thread it through the other side. You're really reaching through that other side. Some people really like to lay that shoulder blade on the ground and just sit there and breathe for a minute. But then you're going to take that arm back out and open it, reaching it towards the ceiling in the opposite direction to open your chest towards the ceiling and towards the wall. And same thing, you're breathing into tension, you're stopping in a at points where you feel tension and tenderness, and continuing to breathe through that. And you're moving through that motion again, nice and slow and in control, and trying to just create more mobility and rotation throughout your spine. So I know I threw a lot at you guys with posture and breathing and this bow and arrow and the chin tucks and all these different things, but that is just such good practical tips for you. And if you need to re-listen to this and get out a pen and paper, I encourage you to do so, because I can't tell you how much just addressing your posture, your breathing, your overall spinal mobility, and your awareness of your posture and breath can really be a game changer. Again, not only for that neck pain and upper quadrant issues that are so obvious, but also for your pelvic floor, and also diastasis recti. So diastasis recti is really, really impacted by thoracic stiffness and those forces not being managed appropriately. So if this is something that you think you need more investigating on, call me, send me a DM, email me, let's get you on a coaching call, or better yet, if you're in New Mexico, come see me in person, so we can really just start to differentiate what is truly causing your pelvic floor symptoms. Is it even coming from your pelvic floor? But then beyond that, are you having foot pain, knee pain, migraines, TMJ, shoulder pain? All of these aches and pains work together, and we need to make sure we are addressing the entire system. I hope I didn't overwhelm you with all of that information. I could nerd out on the kinetic chain for days, but I'm going to leave it at that. And if you have any questions, please come over to the Balanced Momtality Wellness and Support group. It is private and free, and it is a community and a safe space of women just like you to share tips, stories, strategies, and a place where I can give you feedback and just chat. I haven't been super active over there. Honestly, I'm going to just say with summer, it's been kind of chaotic, but I plan to get over there a lot more regularly this fall. And I will also always show up if you guys show up. If I see someone comment or post a story or have a question, I'm there for you. So don't hesitate to wait for me to start that convo, girls. If you've got questions or something nagging at you, feel free to post it over there in the Facebook group. But otherwise, I just want to place a little teaser here. I had another awesome interview with the habit hacker herself, Miss Emily Nichols. She has a great podcast out on habit hacking your health, and I had the pleasure of interviewing her today, actually. And so I will be probably posting her podcast here this week or next. I can't quite figure out. So keep an eye out for that one. It is also going to be so good. Well, that's it for today's episode. I hope you enjoyed it as much as I did, and I want to thank you so much for taking the time out of your busy day. I know you've got so many other important things going on, but I hope it was helpful and you leave here with some tools to help you in your healing journey. And I just want to ask you, if you have found this helpful, to please leave a review on iTunes. Scroll down to the bottom of my podcast page and leave that 5-star review so it can help other women see this information. And also, if you want to be a part of my community of amazing women trying to balance all the things, great tips and insight and sharing stories and just motivating each other along the way, feel free to join my Facebook group, The Balanced Momtality Wellness and Support. I hope to see you here next time on the Balanced Momtality Podcast.